Hey, everybody. Rod Wilt back with another edition of Discover Mercer County podcast. It's great to be hosting this week's show. And we have a great lineup of guests today. And before we get into that too much, I want to tell you that we're broadcasting from the Pettis Communication Center here on the campus of Teal College. Unbelievable studio here. Really want to thank Paul Coatsworth and his students for allowing us the use of this space. And special thanks to Melinda Bowen-Hauk, our marketing membership manager, Swiss Army knife, jack of all trades at Penn-Northwest, for making sure that I got here on time for a change, and I actually was on time today. So it helps when you have to come and teach a class a little bit earlier. But today's show, we have a wonderful guest for you today, Dr. Beth Piccone from UPMC Horizon and Jameson Health Center. Is that right? Jameson Health Center? Is that right, Beth? No, it's fine. What is the actual name of?
I think it's just UPMC Jameson.
UPMC Jameson. But anyway, thank you for joining us on today's podcast. We're excited to hear a lot more about the state of affairs at UPMC Horizon. So before we get into that, though, you have such an interesting homegrown Western PA story. So if you wouldn't mind sharing that with us, I just think this is great.
Not at all. I am one of 5 children. I was born and raised in Newcastle on Englewood Avenue. I went to Newcastle High School, class of 1989. And
Well, look at you putting that right out there.
Listen,
I love that.
I'm one of 4 girls, and I have one brother. And I grew up in a family that had settled in Lawrence County. And to be honest, my father was the first one of his generation to go to college. Neither one of my grandmothers even graduated from high school because they went to work early and had to help support the family. And through education, encouragement from my teachers in high school, I left Newcastle, ended up at Rensselaer Polytechnic Institute.
Wait, you went to RPI? I missed that.
RPI.
So I have a quick RPI story. So not my wife, who we've been together like almost 40 years, but my longtime girlfriend from like teenage crush ended up at RPI from Greenville. So, and I went up there to visit her a couple of times, first couple years of college. What a campus.
My chemistry teacher, John Spina, was wonderful. And he was one of the first people to say, Beth, you can do whatever you want to do. And he said, you would like RPI. You need to go look at it.
Now, how would he know about RPI? How would he know?
Other students. So from other students that had gone there, and he was a tremendous educator. And my mother and I took a trip. I saw it, fell in love, and like a lot of young people, I thought, I'm going to leave small town America and go out into the world.
But Troy, New York is not like New York City.
No. But for the first time, and for any people out there who were like me, who was a female in high school who really liked math and science, it can be somewhat isolating, especially at that time. I felt very different in that there weren't a lot of people that had similar interests. And I stepped onto RPI and I thought, oh my goodness, these people are just like me.
I was going to ask you that because I think that's part of, the homegrown initiative which we're undertaking at Penn-Northwest, trying to get as many local people connected to our education system and also careers. And I always tell young people, don't judge your future by your current. You're going to find your tribe. You're going to find people that are just like you are. And it sounds to me that's what college was for you.
And it was perfect. And I love the experience of being able to learn in an environment and around peers that I still am friends with today. And while I was in college, I became interested in medicine. There were no doctors in my family, so I really didn't know what I wanted to do. But I got a part-time job as a nursing assistant in the health center, and I thought I really like being around these people. I like solving complex problems, and I really like science. So I think I'm going to try to go to medical school. And there really was no basis. My dad was like, "Are you sure you want to do that?" And I was like, "Yeah, I really." The more I got to be around people who did that job or worked in healthcare, I saw early on how impactful you can be in other people's lives. And And so as I started to look for medical schools, I realized that one of the things our area in Western Pennsylvania had was tremendous community. And I thought, okay, I'll go back to Pittsburgh. It's not quite where I'm from, but it's a city and it's close enough. And so I went back to University of Pittsburgh Medical School.
But let me just stop it at RPI. So you're there at an engineering school. That's what RPI is.
Yes.
Were you getting a degree in engineering at the time then?
Yeah, so I was getting it. My nieces and nephews and children, they like to make fun of me because I said, here's what our schedule was like. You took calculus 1, computers 1, physics 1, organic chemistry 1, and then all other classes were in a bucket, and you had to pick one of them. So I took a psychology class, or I took a language, or I took a history. So there was one. And then your next semester was Calc 2, Chemistry 2, and you just added on. But those were my interests. I loved the sciences. So for me, that was wonderful that I didn't have to write papers. I didn't like to write papers.
See, that's what I did. I was an English major, and I just
that would have stressed me out.
oh, I can't imagine.
Chemistry to me made sense.
I can't imagine that, but that's so good.
So I ended up in my second year. I did transfer into. I ended up graduating with a biology major because at that point I had made my decision and I said, okay, I'll go into the sciences. But RPI was it was a wonderful place. It was interesting. We had so you could major in physics, chemistry, biology, 18 different engineering majors. There was a school of architecture and a very small school of business for people who were sort of techie business people, and computer science, and that was it. Like it was 95% of people who were kind of like me, sort of like science, math nerds.
But I can imagine that you were an extremely attractive candidate for med school because not many people are coming to medicine through that academic track.
Yeah, I think one of the things I noticed when I was applying to medical school is that when I would go for my interviews and I could call on my experience as a nurse's aide, and at that time we actually kept patients overnight, so it was a kind of a mini inpatient ward, and I would be able to couple my academic experience with my work experience. That was my biggest leg up because there were many comments, you know what you're getting into.
So I want to go to that. I want to go to that interview process. Where else did you apply for med school, and were you solely honed in on Pitt coming out of RPI?
No, I applied to multiple medical schools. So I applied to Penn State, I applied to Pitt, I applied to Albany Med, which is close to RPI.
Right there, yeah.
I applied to Johns Hopkins in Baltimore, some of the schools in Boston, Tufts, BU, Mass General, Harvard's medical school. I applied to, those were kind of, and a few other northeastern schools, some of the Philadelphia schools. So I kind of, and again, there weren't tons of people at RPI going to medical school, and I didn't have anyone in my family who did this, so I was sort of
you were the pioneer.
figuring that out.
Yeah.
And then I had kind of narrowed it down to Pitt. I was looking at a school in Boston, Penn State, and those were the ones when I went to visit. I was lucky enough to have received multiple acceptances, and those were the ones that when I actually went to see, I always encourage kids, go see the school. Because to be honest, there was one school in Philadelphia, and I went to visit, and I was like, I can't go here. I couldn't live there. And so it's really important to see the environment, and then if the environment is conducive to your type of learning.
So you end up choosing Pitt.
I end up choosing Pitt.
And then once you got in, your career path was then what? Is it cardiology from what I understand?
It's cardiology. So I have a little aside. So again, being one of 5 children in a very close family, we are those people where we have holidays with 50 people, but if you go more than 50 miles, you have no one, right? So everybody is centered around one area. And my father in his 40s, I was actually 19 and at RPI when my father was diagnosed with a significant heart condition. And part of my reason to come back to Pitt is that I wanted to, it really brings it home that I don't know how this is going to go, and I want to be closer. And And so that was part of my decision, and came back to medical school at Pittsburgh, and that's where I started my medical career.
So most, but not all, people in healthcare administration come at it from the business side, but you came at it from the healthcare side. So when in your career did you figure out, hey, I love, and I know you're still practicing, but I love the practice of medicine, but there's another part of me, because you didn't talk about any of your business acumen that you developed along the way. So where did that start to germinate, and when did you start to feel like you were being pulled in that direction? Because I find it fascinating. You have this heavy science background, physician, cardiologist because of a family connection, but now you're running a hospital system. So,
Yes, it's an unusual story in that, and I think there's a couple of things that I would point out. One is, I think ultimately I'm a problem solver. And I also didn't get the memo where you can't do things. If someone says to me, you can't do that, I'm like, why?
mm-hmm.
And then I'm like, why not? And what happened was I loved, as I went through my training, I loved being a doctor. I loved taking care of people. And one of the things I love about cardiology is it's very data driven. You get your diagnostic test, you evaluate the patient, you take your information, and then you chart a path forward. I had no business training. But as I was finishing my cardiology training, I really thought, at the time I started dating somebody who was from Newcastle, that I knew. My husband, he's actually not medical. He's in the beer business by trade. Um, but his family was from Newcastle. I was from Newcastle. And as I just started to look at things, at this point, when you go through your training for cardiology, you do medicine training first and then cardiology. And I was about to be 30, and Michael and I were serious, and we really we actually got married when I was 30, and had my first child at 32. And when we were looking at places to go, it really, as I started to look at it, I wanted to make a difference. I thought there was a lot of opportunity at home, and I wanted my child to be raised in the same environment that I was. And I decided to take a position in Lawrence County at the time in private practice. And I worked in private practice for 8 years. And running a private practice where there were only two of us is really where I got a lot of my business training. I learned about insurances and about throughput and about money in, money out, and the economic aspects of medicine. That was really great training. And honestly, I always encourage people to, yes, follow your heart, but take advantage of opportunity. I never thought I would end up in the position that I'm in now. It was never like, let me see what I can do to become a hospital president. It really was, let me look at the situation. There's a lot of issues about how we're delivering healthcare. How can we come together and try to do this differently? Okay, on to the next thing. So when there was opportunity, I just tried to step into opportunity. And there was a very large opportunity that occurred when UPMC decided to merge with Jameson Hospital.
I was going to ask you when that connection started to take hold, because somebody along the way had to have identified you, or you identified yourself, talking about opportunities and not letting anybody tell you no, which is another thing I've picked out of our conversation so far. So it was when, well, your practice was not owned by UPMC or the hospital. You were running it on your own, you and your partner, and that's kind of where the catalyst was. But once you joined, the hospital joined UPMC, how was that path created for
And
you?
so I think it's really it goes to another important thing, is having mentors and people that you can trust to just give you some guidance. Because for a very long time, I always felt like I'm just the girl from Newcastle High School, and I don't know why people will think I can do these things, right? And over time, I realized sometimes other people having faith in me made me have faith in myself. Because if they thought I could do it, then I thought, oh, maybe I can do this. So basically, what
Mm.
happened was we were running the private practice up until 2011, and I had a son who was 3.5, and my husband and I were pregnant with twins, And
You just love running into it,
and
don't
I
you?
was like, oh my God. So at that point, after the twins were born, and again, the importance of community. My parents lived locally. My mother-in-law, who is an angel, is within 3 miles. So as much as people say I want to leave an area, I wouldn't live anywhere else
Mm.
because I had so much support to help me through each and every part of my journey. So in 2011, the kids were about 4 years old, and it really just was becoming too difficult. With two people in private practice, we were basically working 12 days straight for 2 days off. And I was like, I can't continue to do this. And an opportunity came where McGee Women's Hospital in Pittsburgh did not have a general heart doctor that was a female. And my mentor, Dr. June Lee, who was at the time running the Heart and Vascular Institute, said, I think this might be something you're interested in. And I knew that I did not want to be in private practice anymore, and it just so happened that the opportunity that UPMC had was in Mercer County at Shenango Valley and Greenville, with some time at McGee. And so in 2011, I left private practice and I came to Shenango Valley and Greenville, and I worked in those two areas with some time in McGee for the next 5 years.
And at that time, you were just practicing
Cardiology.
just cardiology. And then somewhere along the way, that morphed into more of a administrative, and then you got on this other career track.
And I'll tell you how it started. I remember that I had been working in Shenango Valley in the practice for maybe 6 or 7 months, and I started to look at how we were scheduling because we were having trouble getting people in, and at some of the doctor scheduling. And you don't realize how much experience you pick up through every job that you have. So I was a little more in tune with throughput, having had the pressures of private practice. So I started to look at it and I said, why are we scheduling like this? Like, it doesn't make sense. And so I sat down with the manager and I said, I think that we can optimize and decrease our new patient wait time if we look at this. And then I talked to the other physicians and said, why don't we do it this way? This will be much more efficient use of our time. And they're like, oh, we didn't think about that. Or a lot of times people do things they're used to do because that's what they're used to do. So that was my very first kind of by accident foray into administration, was just seeing a problem and saying, hey, let's kind of see how we can address this.
And how do you pull that through? I mean, I don't really think of physicians necessarily, and this is probably wrong, but being that accepting of change. They've just got a certain way about how they do things. And so did you find that difficult? Were you swimming upstream a little bit with some of your ideas?
So it's always challenging, but here's where I think when you're speaking with physicians, whether you're a physician speaking with physician or outside, I think that ultimately you really have to explain the why. So why are we doing it, and how is this actually going to help our patients and help things to function more smoothly? And I think sometimes people don't talk to physicians about the money side of medicine, or that people need to, what the wait times are, or that someone's waiting, they're removed from that, almost to some extent protected at times. And so I took a very different approach and was really kind of brutally honest about, here's where we are, here's what's going on, and here's how actually this will help our practice to be stronger. The stronger our practice is, the more resources we can attract. And so it's really important to define the why. And I have found that dealing with physicians is not difficult. It's just that people often don't share fully transparent information. It's as if there's silos. Like, we're going to keep the business on this side and the clinical on that side. And then people are very far removed and they don't understand why they have to change.
So then COVID hits at some point, and it just blows up the healthcare system in one sense. Probably changes a lot of paradigms instantaneously. You now get back to a whole other reason for, here's what we're going to do, here's why we're doing it, who's it going to benefit, which is one of the mantras that I try and deploy in my area. But how did the COVID pandemic change your reality now as a relatively new president of a healthcare system, and what was it like at that point a few years ago?
So, a couple of things. Just to back up one step from that, just to lay some groundwork. So if you think of my three hospitals, Greenville, Shenango Valley, and Jameson were all doing exactly the same thing. So we were replicating each other across not a huge geographic area. And so when UPMC merged with Jameson and we had all three hospitals, and I'm so proud of the people who did this work and that we were able to sort of do this prior to the pandemic, is we started to regionalize things. So say, okay, we can't have 3 ICUs because we're going to have difficulty staffing, we can't attract the talent, but we can have one really strong one. Where should that be? And so that went to Jameson. Geez, we can't deliver babies in 3 places. We have one really, really strong place. And so that went to Shenango Valley. And we took steps to have, for instance, outpatient centers within Greenville Hospital. We moved some of the offices inside, especially our cancer services. So there was a lot of work that was, to be honest, difficult, because if you're changing things, um, it's not always well received. But by the time COVID hit across Mercer County and into Lawrence County, we were fully regionalized. So COVID comes. And for anybody working in healthcare, I would say there's a lot of young people in healthcare. The last 3.5 years are like nothing I've ever seen.
It's not what your life is. It's not what your life is going to be. It's not what the rest of your career is going to be. Okay.
Like. In 20 years in clinical cardiology and clinical medicine, working in hospitals of various sizes, I never saw anything like this ever. And so I think that when something like COVID happens, it really instills the need to communicate transparently. And it's okay to say, we don't know exactly what step 2 is, but here's where we are right now, and here's why we're making this decision. And let's openly communicate. That was the most important thing, because I never saw anything bring our country, our industry, healthcare to a halt and add so much fear and anxiety to everyday life as what I experienced with COVID.
And this is my perception, not a heavy user of the system, but my wife was with a cancer diagnosis. But it seems to me that regionalization, your ability to communicate the mission, I'm just pulling all this from our conversation, very collaborative and willing to listen and willing to have your mind changed, that it seems like this approach allowed Jameson, Farrell, Greenville of the Horizon system, you weathered that storm pretty well, it seems.
I think there were a few things. I think the fact that we were backed by such a large system was so helpful. So, for instance, we never had to worry about masks or PPE or anything like that. We always had intact supply chain, which was invaluable. And we had world-class experts in infectious disease guiding us. And so that, bringing that information down to our community level, really helped us to say, okay, here's what we're going to do and how we're going to do with this. But we would tell people regularly, go to the ER. If you have a problem, go to the ER. Then all of a sudden it's like, don't go to the ER unless you know you're dying.
Right.
Don't go to the ER. Don't leave your house. And you know, we'll be unpacking this box for 10 years, but it was devastating, the effects that COVID and the pandemic had on our elderly population, on our young adults who had a lot of isolation. A lot of people didn't, you know, the mortality from a heart attack quadrupled during COVID because people didn't come to the hospital. And so there were a lot of issues we had never dealt with that all of a sudden we were. But again, collaboration, information, and really the vulnerability to say, we're going to do the best with the information we have and pause and pivot if we're not going down the right road. And sharing that. You don't, because you're in a leadership position, you don't have to know everything. You just have to, I think people have to trust that you're going to try to do what's in their best interest.
I can't wait to listen to this podcast back, because I am picking up so many great things about how to manage and how to lead that are just they're just rolling out of Dr. Piccone's mouth like, oh, this is nothing. This is how, but it's not how most people do it. It's this unique approach that you're bringing to this role and this unique background that I find fascinating. And I could just keep this rolling forever and ever. We've got about 5 minutes left, and you're listening to the Discover Mercer County podcast, and our most interesting guest is Dr. Beth Piccone with UPMC Horizon. So we're looking now at a system after COVID, the economy's starting to take off regionally again. One of the things that I've found fascinating is this whole growth in telemedicine now. Is this something that the UPMC system is putting a lot of weight behind, or is it just something that's going to phase out and we're going back to a lot of face-to-face? What role does telemedicine have in that PCP and those follow-ups? Is it here to stay? Is it something you can grow with, or where do we go from here?
So I think COVID, I always try to look at, the good side of bad, and COVID really advanced that technology by 20 years. So telemedicine has a place, and it has a really good place in some aspects. It will not replace in person, but what I like to look at is telemedicine can enhance, especially in more rural communities, our access to excellent physicians that we might not be able to otherwise attract. So for instance, and especially in specialties where it's not that important to listen to their heart or listen to their lungs, psychiatry is one of them. So for instance, we use in our hospitals a tele-psychiatry model where if someone's in the hospital and they need to see a psychiatrist, which can be very difficult, they have an iPad. They talk to one of our psychiatrists from Western Psych, so excellent physician. They have on-site support from nursing, and they're able in sort of a very private manner to receive psychiatric care that they would otherwise either go without or have to travel an hour and a half for. So in that aspect, telemedicine's great. It's also great sometimes for people who just want to dial up on their phone and say, can you look at my finger and see what this looks like? My ear hurts. Does it look bad?
That's great.
It's a matter of convenience for some people, so it has a place. Now, but the practice of medicine is not going to go away from physicians or other providers. It can help us to address gaps, and really help us to get, for example, infectious disease is another one. They look at what bug do you have and what is our best way to treat it. And their standard of care is excellent. And honestly, those things come into our hospital over a computer screen, and it's extraordinarily high level. Without that, we wouldn't have that service.
Yeah, that is just so great, so great. When you look at Mercer County, Lawrence County, your service territory, I'm blown away by the quality of the healthcare, but maybe I'm missing something. When you look at the system that you run as the president and how it fits into the whole fabric of the UPMC network, how would you rate our system? Is there room for improvement? Are there things that you're working on right now? And what is UPMC Horizon really good at? Because I feel fortunate to live back in Mercer County now with access to Western Psych, the Cancer Center, all these things that we have access to within minutes of our rural community up here in northern Mercer County where I live. But what are some of the things you're working on to continue to improve access and quality for those in our region?
So, one of the things that inspires me all the time is this idea that if it's here, it can't be good, right? Why would anybody live here? Why would anybody want to stay here? We want to get out of here. I'm like, look, I could live anywhere in the country. There are no female cardiologists. I choose to live here, and I choose to live here over and over and over again because we have a community. We have people who care about each other. If something bad happens, there will be 40 people at my door, and 30 of them I don't even know. And I can't imagine a better place to raise family than places that have such tight community. And to that end, physicians, we've had tremendous success in recruiting physicians, because they come. For example, our GI doctor who works on stomach and digestive issues came from close to Philadelphia. He came to Greenville and said, I cannot believe how wonderful these people are.
See, that's what I think, but I'm from here, so I'm always accused of being biased, but I've moved back here twice. And it seems to me what I'm gathering from our conversation with you, Dr. Piccone, is that you run your hospital the way a community runs, that you really do connect with people and you make them feel like it's bigger than just running a hospital. It's bigger than just coming to work. And it's amazing to me you're able to create that atmosphere across 3 different sites and, I don't know, hundreds, over 500, 600 employees. How do you do that? That's amazing to me.
Listen, it's a team, and it's basically a vision, right? When people think about healthcare, too often they think about hospitals. Hospitals are important, but really as we go forward, what's important is access to care, and so much is shifting to the outpatient. So for instance, you get chemotherapy as an outpatient. You get radiation for cancer as an outpatient. Most cardiac things are done as an outpatient. So when people look at we have less inpatient beds, that's actually a good thing. We should, because the hospitals are not where you want to receive your care. You want to have world-class hospitals when you really need them. But what we want to do is create access in a healthcare environment where only the sickest people need to be in the hospital. And so to that end, I mean, we in the past 18 months, we've recruited something like 17 doctors,
wow,
variety of specialists, PCPs. Our cost of living is extremely favorable, and really healthcare is about taking care of your community. A lot of people who work with us know it's their neighbors, their friends. They really want to be impactful, and I think to that end, if you're having impact on other people's lives, you will never feel burnt out.
That's so well said. Before we close down, we're broadcasting from the Pettis Communication Center here on the campus of Teal College, our Discover Mercer County podcast with Dr. Beth Piccone from UPMC Horizon. We keep hearing about the shortage of nurses and support people in the medical community. Where does that stand today, and how long do you think it's going to take us to work through this issue?
So honestly, I think we're looking at a 2 to 5 year lag. But I will say this, and this is what I've said to my team. It's all about culture, and culture will rise above everything else. So our goal is to be the place that people want to work. So you're a nurse and you have multiple choices of where you want to work. We want you to see what our atmosphere is like and what our culture is like, and want you to want to come to work. That we want to be the employer of choice. And so we have really doubled down on that and trying to take care of each other and create a innovative environment and a caring and collaborative environment so that people who work in those fields want to come and work for us. And I think because of some of the tremendous people I have working with me, we are having successes in that area. But I think it's still going to be challenging really for the next 2 to 5 years of till things are the post-COVID disruption is kind of remediated.
Well, I can tell you this, from listening to you talk for the last half hour and just your background, your commitment to our community, family, I know you're the right person for the job. I am just so thrilled that you're here in our community where you grew up, living and breathing our homegrown initiative where we continue to talk to young people about you can have a successful career and a successful life here. And we can't thank you enough for joining us, Dr. Piccone. And for those of you listening to the Discover Mercer County broadcast, I'm Rod Wilt, the Executive Director at Penn-Northwest Development Corporation. I want to thank you for listening to this edition of the Discover Mercer County Discover Mercer County podcast here from Teal College. Again, want to thank Melinda, our marketing membership manager at Penn-Northwest, and also Paul Coatsworth and his team here at the college. So stay tuned. We have another episode coming up next week. We really appreciate you. And if you want to connect with us, you can do that on our website, which is www.penn-northwest.com. I think we put that up on the screen. You can also give us a call at 724-662-3705. And obviously, you can find us on social media where we really have ramped up our LinkedIn presence. So connect with us there as well. We'll see you next time on the Discover Mercer County podcast. Take care, everyone.